in the neighborhood behind Mackenzie Willamette Hospital. And then I also work at U of O in the graduate program. My job there is a couple different things. I work with the graduate students to find placements for their 10-week full-time kind of like student teaching, their internships. And we find placements all over the country for our students. And then I supervise graduate students in several settings. I have some that come and work with me at Maple. And then I have worked at our on-site clinic when we can see students, see people in our on-site clinic. We have HeadCo Clinic at U of O, part of the College of Ed. It's an interdisciplinary clinic, so we share the space with the counseling program and with school psychology and a few other departments, which is really great because we're able to co-treat sometimes. So we have been able to, with some clients, maybe they need speech and then they also need counseling. And we have been able to work together with the counseling graduate students and really provide that wraparound service. So it's a really great setting to work in. For my job in Springfield, part of what I do is coordinate the assistive technology that our students who are diagnosed with a hearing loss use in the classroom. And then all of our SLPs do hearing screenings in their buildings. So the Oregon regulation says that we need to screen all students upon entry to school. And so in a normal year, we screen all of our kindergartners. It's quite the process. We work as a team and we kind of get our graduate students in to get some experience also. And then we'll partner up with other buildings so that I have somebody come and help me and then I go and help them to help, so it's a little more streamlined. In the past, we have used these giant audiometers. I mean, they were big. Mine was held together with packing tape. I mean, they were so old. Audiometers are really expensive. It's about $1,000 to replace one of them. And then they need to be calibrated annually. So every summer we send them to a vendor who makes sure that the tones that it says that it's producing are actually what it is producing. We have been asking for new audiometers for years, and we last summer were surprised to learn that we got new audiometers. So I'm going to show you our brand new, I haven't even used these yet. It's like I just got it out of the box because I haven't had students that I could assess. So our new one fits in our hand. It doesn't even need to be plugged in. It has a battery pack, which is really nice because I always struggled to figure out where to put my students. I have outlets in my office that are in strange places. Like there's one in the middle of my whiteboard behind me, like not very useful. So I would have cords running everywhere. There are also the old ones that were really big, were kind of intimidating for kids. This is a lot less intimidating. So I have my little audiometer now. And the other nice thing is that the headset that comes with it is child size. So it used to be we were trying to get these big giant headphones on these little tiny heads. And so our new ones are nice and small, so they won't fall off the kids. We won't have to like squish them way down onto their heads. Our procedure in the fall usually is that we send a letter out to all the kindergarten parents and we let them know that we'll be conducting hearing screenings. Oregon law says that we have to notify families and give them the opportunity to not have their hearing checked. So if we could have have people sign a permission slip, but that's a lot of paper. So what we do is we actually say, if you do not want your child's hearing checked, please let us know. And every year there's a couple for various reasons. When I am screening students, I am checking in with the classroom teacher to see, is there anything that, any students I should really make sure to pay attention to, anything that stands out in the classroom, are they having trouble following directions? And then we really try to make sure that we use very age-appropriate language when we are explaining the procedures. So I always tell the students, you're going to hear a little sound. It's going to be really, really quiet. And even if you think you hear it, I want you to raise your hand. I tell them the first thing they ask usually is this going to hurt? So I assure them it's not going to hurt. It's not going to be loud in their ears. We have a lot of students with sensory needs, so kids with autism and other sensory disorders. So I always ask permission before I put the headphones on them. So I will hold the headphones up and say, I'm going to put these on you. And I want to make sure that's okay with you before I do it. Because, partially because if they're upset, I'm not going to get a good result anyway. And also because we want to model for the kids that somebody should ask before they get in your space. So I always ask. I can ask them, do you want me to fix your hair and pull it back, or do you want to do it? Again, really helping them feel comfortable with the screening process. Then once we have done the hearing screenings, every year there are a few kids that fail the hearing screening. So our procedure is that in general, we will recheck for the families about 3 weeks later, just in case it was a cold or ear infection or something like that. If they still don't pass the hearing screening, then we refer to the pediatrician. I am always very mindful about when I refer. A lot of our students, their families are working multiple jobs. They may have transportation challenges. Co-pays may be a barrier. And so I really want to be mindful that if I'm asking a family to follow up with a doctor, that it's a real need, because, I have 2 kids, and if I have to take them to the doctor, that's 4 hours of sick leave because I can only take a half day. And that disappears quickly when you have small children. And so I'm really mindful about what I'm asking of our families. Please jump in with questions as you have them too. So once we have a diagnosis, if they go to the pediatrician and they fail again, then they'll refer to the audiologist. So if I have a report come in from the audiologist, we provide equipment to help the student be able to hear at school. Our job is to ensure that children are being educated in the least restrictive environment and with equipment that meets their needs. The equipment really varies. Let's see, I have some of it here. For some students, we have a little, you change out the battery door on their hearing aids and you put this little box in. It's a little, call it a boot. We change their shoes for boots. And that makes it so that it will connect to a little microphone that the teacher wears. So this would be on a lanyard. This is a broken one that I have to send back, but it would be on a lanyard and the teacher would wear this. And then the sound goes directly from the microphone to the child's hearing aids. For other students, we have a speaker in the classroom. So if they don't need that level of support, we will bring in a speaker, and then they use this microphone, the teacher does, and connect to the classroom speaker. We also, here, I've got one of those little, I'll show you guys. Nope, this one's empty. This is the one we just used up. We also will make sure that the students have any accommodations that they need, like, being able to take a test in a quiet location, have things closed captioned if they need that, note takers, anything that we can do to remove as many barriers as we can, and even that playing field. Just like we would give a kid glasses, we want to make sure if they can't hear that we are supporting them. We do have some specialized programs. So most of our students with hearing loss are in just our general schools and getting support from our special education staff. There are some regional programs. 4J, the Eugene School District, houses a regional program for kids preschool through high school who have significant hearing loss. At elementary, it's at Spring Creek now. It used to be at Bertha Holt Elementary. Um, and they have staff there that are specifically trained on how to support students with hearing loss. They are sign interpreters. They know the research around teaching children who are deaf and learning ASL how to read. It's a different language structure. It's actually based off of French. So the syntax is not like English. So they have to teach them reading in a different way. And then we do have some students who go up to Oregon School for the Deaf, either as day students or as residential students. As we are able to provide more and more support in the schools, fewer students are needing that level of support. But for some students, that community is really important and necessary for them to be successful socially and academically. So that's up in Salem, and we do still have some students that are going up there. It's kind of a really quick rundown of what we do. What questions do you guys have?
People, go ahead. Let's, if you have a question, just raise your hand and Sarah will call on you.
Okay. Brad, what's your question?
What make and model audiometer are you using now, Sarah? That looks a little bit familiar.
Yeah, this is called an Earscan 3.
Oh, they just look different. That's the instrument that we at the Oregon Lions Sight and Hearing Foundation have used.
Yeah,
we really like it.
It's a really great one. And we got it through a vendor in Staten. We used to use somebody up in Portland area to do all of the calibrations. And it was really challenging to get it done. See, there go my lights. Let me roll myself around and turn my lights back on. They do eventually turn on.
I had one of those when I was detective sergeant. I kept a flag at my desk.
Yeah. Well, the funny thing is I never have to go to the same place twice. Sometimes I go right, sometimes I go left. The sensor shouldn't move, but yet it does. I don't get it.
Yeah.
So we found this guy in Staten who has a business with audiometers. He also provides the audiometers and calibration for Eugene School District. So
Great,
we were able.
Yeah, we're not having real good luck with our calibration.
Yeah, I'm happy to send you guys the name of the person that we went through. He was great, and we bought, I think, 12 of them. And so we got a discount. I mean, as much as you get, but it basically worked out to be like one of them free.
Great. Second quick question. Sorry to
That's okay.
capitalize on all this, but I'm going to. What sound level do you test the room at before you start testing?
We don't test the room. So our national standard is that we do hearing screenings at 20 decibels. And you can bump up to 25. So in my office, I'm on a main hallway. I have the elevator equipment room off my office because that makes a ton of sense.
Oh, doesn't it?
And I have a really loud return air vent periodically. It just kicks on and sounds like a jet engine. And so I will, if a student passes at 25, if they respond at 25, I consider it a pass because we know that it is not a true, it's not a perfect environment. And then we test at 1,000, 2,000, and 4,000 hertz.
Yeah, that's essentially the same thing we do, but we're stuck with testing the rooms because we do it in different places when we do it. We've actually not we've put our program on vacation for a while we determine how best to reapproach that.
Yeah, well, and I think in most local districts, the speech pathologists and nurses are coordinating it. And part of it for us is the scheduling. Like, it's nice for me to do it because I know what the kindergarten schedule is. And like, if I've got 30 minutes, I can run down and get 6 kids taken care of. And then I can go back to that class later in the day and get 6 more. But we could definitely, if you guys are ever interested in talking about ways that districts need support, that is definitely something that we could do.
Well, yeah, most of the screenings that we've done are in districts that are so large that their speech language pathologists are so overworked that they just call us in. And I got to commiserate with you. I've done hearing screenings for kinders, and that is a chore.
Yes. Yep. It is. It is. It's really nice when I can bring the grad students in to have some extra hands. We also have a number of grad students who are bilingual, and so that's really helpful. Through the U of O, we also have an OAE machine, otoacoustic emissions, which tests it's basically, it makes it so the kids don't have to do anything. It's checking the movement.
Objective.
Yeah. And
mechanical.
So it's good for our students who can't respond or won't respond, or we are getting inconsistent responses. We got that machine a couple years ago for U of O. So it's not something that we have in the district. They're really, really expensive, but U of O is willing to partner with all the districts to bring that in if needed, because it's a good experience for our students.
Yeah, we looked at that, and we're still trying to get the information whether the child is interpreting sound. So,
right. Yeah. What other questions are there? James, it looks like.
A while back, our club had a presentation on hearing loops. And the person giving the presentation pretty much made it sound like that is the wave of the future for hearing assistance. How do you feel about that?
Hearing loops have a very specific, they serve a very specific role. So they are very important, but it's not really helpful in schools because you have to loop the space. So our students are moving around all the time. And a loop is something you install. So we could install one in kindergarten for that kindergarten student, but then when that student goes to first grade, what do we do? But they are perfect for things like the Holt Center and, places where you need, that you're going to have the public coming in and they're going to come to that spot and you're going to have multiple people going there, and that will be a way of providing access. But in the schools, it doesn't really work well. Maybe at the front office when we can have people in the school, if we needed to have a way for the public to access our office staff, but not really for students. Susan?
Sarah, you said that Spring Creek Elementary is where the children who have hearing loss attend school in Eugene area. What about the middle school and the high school?
I'm not sure where, so they just moved some of their programs around. I think, because it used to be Holt, Monroe, and Sheldon, and I think it's now Spring Creek, Kelly, and North, but I'm not really sure. One of the reasons they moved the programs is because Kelly and North have ASL as a language option for their students.
Oh.
And so they wanted, by putting the program there, it gave the students who are deaf a community that they could tap into. Plus, I think they had more space. I mean, sometimes we make decisions based on just where we can fit people. What other questions are there?
I wanted you to say again what the OEA machine is?
OAE, otoacoustic emission.
Oh.
If you've ever, so now in Oregon, all newborns have a newborn hearing check. And that's one of the things that they are doing, that's how they do that, because you're not going to get a tiny baby to respond to tones. So it's a way that you are assessing hearing, and it's actually like checking the movement. It's not bone conduction. It's not straight to the inner ear. It goes through the middle ear, but they can check the movement of the bones and the tympanic membrane and all the components. It's not something that I use frequently, just because I haven't had a need to. And so it's not something that I am well versed in. But it is, and it's one of those things that you definitely need significant training in order to know how to interpret the results, because you interpret them differently than you would just a standard pure tone audiometer.
Very interesting.
Any other questions?
I do want to thank your office manager. I don't know whether she's your coordinator supervisor, but Samantha Schoon is
She's our department chair.
department chair.
Mhm.
And she, her name was given to me by the late Mary Voorhees, who is our immediate past president, who died suddenly in April. And it was only a couple of weeks before she passed away that she got me that name and told me, you should get in touch with this person at the University of Oregon. She will give a good talk. But when I told her told Samantha what we do, she lined us up with you, and she said there's someone else in that office that does more like the things that the Sight and Hearing Foundation.
Yeah, absolutely. Samantha's work is actually around feeding and swallowing disorders. And on, oh, there go my lights again. Let's see, where is it going to turn on this time? There we go. And on how, after a stroke, has and struggles with eating, she looks at the social ramifications of feeding disorders and eating disorders, which is really an interesting angle. So there's actually our degree, our license covers a huge range of work. We say we serve the lifespan because we have SLPs working in the NICU and with premature babies for feeding and swallowing. And we have SLPs working in memory care with patients with Alzheimer's, traumatic brain injury, voice disorders, just a little bit of everything.
Very interesting. Are there any other questions that people have?
Well, if you think of anything later, you are welcome to send me an email. Susan has my contact information. Otherwise, enjoy the rest of your meeting, and I'm going to get ready for my 2:00 meeting.
Okay, well, I will connect you and Brad. I'll CC him on an email so the two of you can connect about the state and calibration place.
Fabulous.
Thank
Fabulous.
you.
Have a great rest of your day.
Thank you.
Bye.
Thanks, Sarah.
Okay.